Key features and anatomical relations. The vomer is a single thin, quadrilateral bone that is located along the midline between the right and left nasal cavities. It is classified as a flat bone and contributes to the formation of the bony nasal septum, nasal cavities, and viscerocranium. Articulates with sphenoid, ethmoid, and palatine bones, and maxillae, arterial supply, sphenopalatine artery. Parts of vomer. 1. The alae are the two wing-like, lateral projections that form the posterosuperior part of the vomer. They are continuous antero-inferiorly with the cuneiform part of vomer and articulate with the inferior surface of the body of sphenoid bone, forming the sphenoverine suture. 2. The cuneiform part is the flat, wedge-like, vertical plate of bone that forms the antero-inferior part of the vomer. It is continuous posterosuperiorly with both the right and left alae of vomer, contributes to the formation of the bony nasal septum. 3. The choni are a pair of large, oval openings found along the posterior aspect each nasal cavity. The right and left choni are separated from each other by the posterior border of vomer. They allow for the communication between the nasal cavities and the nasopharynx. Surfaces of vomer. 1. The anterior border anterior margin is the long, thin, oblique margin of the cuneiform part of vomer. Provides an attachment site for the septal nasal cartilage. 2. The inferior border inferior margin is the thin, horizontal, lower margin of the cuneiform part of vomer. 3. The lateral surfaces are the two smooth, flat areas found on both the right and left aspects of the vomer. Contributes to the formation of the medial wall of the nasal cavity on its corresponding side. 4. The posterior border is the thin, concave, non-articular margin of both the alae and cuneiform part of the vomer. The superior border superior margin is the thick, grooved, upper margin of both the right and left alae of vomer. Landmarks of vomer. 1. The nasopalatine grooves are the narrow, oblique depressions found along both the right and left lateral surfaces of the vomer. They each travel antero-inferiorly from the superior border towards the maxilla, and each lodge a nasopalatine nerve and vessels. 2. The vomerine crest of Chona is the concave ridge found along the posterior border of the vomer. It separates the right and left choni posterior nasal apertures of the nasal cavities. 3. The vomerine groove is the narrow, shallow depression found along the anterior border of the vomer. It provides an attachment site for the septal nasal cartilage. Sutures of vomer. 1. The sphenoverine suture is a fibrous joint of the cranium. It is the articulation site located between the inferior surface of the body of sphenoid bone and the superior border of the vomer. If you found this deep dive into the vomer bone fascinating, make sure to subscribe and hit the notification bell so you never miss out on our future anatomy lessons. Have questions or want to see more content like this? Drop a comment below and let's keep the conversation going. Remember, understanding the basics of human anatomy is crucial for any aspiring healthcare professional. So keep learning, keep exploring, and let's ace that knowledge together.